Bipolar disorder is a mental disorder that causes unusual mood shifts, as well as fluctuations in energy, activity levels, and the inability to complete everyday tasks. Bipolar is a serious mental illness that can cause damage to relationships, career prospects, academic performance, and may even lead to suicidal tendencies. A patient with bipolar disorder has severe fluctuations in mood, from depression to mania. A clear understanding of bipolar disorder as a mental illness was first discovered by early Chinese authors. Following them was Avicenna, a Persian physician and psychological thinker, who identified bipolar disorder as a mania depressive psychosis. The conceptualization of mania depressive illness was developed by the German psychiatrist Emil Kraepelin. He categorized and studied the natural cause of untreated bipolar patients and coined the term mania depressive psychosis. The ancient Greeks and Romans coined the terms mania and melancholia and used waters of northern Italian spas to treat agitated or euphoric patients. In 300 to 400 BC, the ancient Greek philosopher Aristotle had thanked melancholia for the gift of artists, poets, and writers, the crafty minds of his time. Conversely, in the Middle Ages, those afflicted with mental illness were thought to be guilty of wrongdoing. It was thought that the illness was a manifestation of bad deeds. According to Kara Garden-Swartz, who has specific expertise in bipolar disorder and in its history, some people with bipolar disorder were euthanized. These people were viewed as crazy, possessed by the devil or demons. Their treatment or punishment, she explains, included restraint or training. The blood was let out and they were given different potions. Witchcraft was often used to try and cure them. In 1621, Robert Burton, who is an English scholar and writer, wrote The Anatomy of Melancholia, a treatise on depression that defined it as a mental illness in its own right. Measurable progress was made in the early 1850s when Jean-Pierre Fauret, a French psychiatrist, identified mania and melancholic episodes that are separated by symptom-free intervals. He broke substantial new academic ground when he chronicled distinct differences between simple depression and heightened moods.
There are 4 types of mood episodes involved in bipolar disorder: hypomania, mania, depression, and mixed episodes. Mood episodes with bipolar disorder are intense and noticeable. Hypomania is a less severe form of mania. People feel euphoric and energetic, and it may seem as though they are in an unusually good mood. However, it can result in bad decisions that may induce harm to relationships, careers, and reputations. Also, hypomania often develops into full-blown mania, or is followed by a major depressive phase. In the manic phase, feelings of heightened energy, creativity, and euphoria are common. They may feel like they're all-powerful and invincible, and thus cause them to behave recklessly. They may become angry, irritable, lash out when others don't go along with their plans, and blame anyone who criticizes their behavior. Some people may even become delusional and hear voices. Bipolar depression involves irritability, guilt, unpredictable mood swings, and feelings of restlessness. People with bipolar depression tend to move and speak slowly, sleep a lot, and gain weight. They lose contact with reality and experience major disability in work and social functioning. Common signs of mixed episodes include agitation, irritability, anxiety, insomnia, distractibility, and racing thoughts. This combination of high energy and low mood creates a high risk of suicide. In adults, bipolar mood swings can last for months. However, teens may experience shorter mood swings, going from mania or hypomania to depression in a few hours or days. Some people with bipolar disorder turn to alcohol and drugs because they feel better when they're high. However, substance abuse can make the symptoms worse and the conditions much harder for doctors to diagnose and treat.
Bipolar disorder occurs in roughly 3 to 5% of the population. In any given year, about 1% of the US adults, which is equivalent to around 2 million people, have bipolar disorder. Both men and women are affected at the same rate, and it is found in all ages, races, ethnic groups, and social classes. Painful life experiences play a powerful role regarding the development of bipolar disorder. Genetics and one's family history also affect the likelihood of being diagnosed with bipolar disorder. However, Most children who have a family history of bipolar disorder will not develop the illness. The estimated age for the onset of bipolar disorder is during the early 20s. Younger patients may initially suffer cyclothymia, characterized by mild depressive episodes. Women with bipolar disorder may have more depressive episodes and mixed episodes than men. Bipolar disorder also results in 9.2 years reduction in expected lifespan, and it is estimated that as many as 1 in 5 patients with bipolar disorder commit suicide.
Studies show that bipolar disorder runs in families and is 75 to 80% hereditary. Although there is a genetic link, one bipolar parent or even two will not necessarily produce a bipolar child, but if both parents are bipolar, a child will be 10 times more likely to develop the condition. Identical twins are also more likely to have bipolar than fraternal twins. This difference in risk displays the role of heredity as a cause of the disorder. But studies of identical twins who share 100% of their genes indicate that bipolar disorder is not caused entirely by genes. This is evident where the identical twin of someone with the illness would not always develop the illness, suggesting that the environment also has a role to play in accordance with the number of genes involved, and that different families may have different causes of bipolar disorder.
Treatment for bipolar disorder. The aim of the treatment for the bipolar disorder is to minimize the frequency of maniac or depressive episodes and to reduce the severity of symptoms so that the patient can lead a relatively normal and productive life. Treatment for bipolar disorder includes a combination of different therapies and medication, which may also include lithium and anticonvulsants. Lithium is the oldest and most well-known mood stabilizer. Mood stabilizers are the medications that help to control the highs and lows of the bipolar disorder. They bring mania and depression under control and prevent relapse once a person's mood has stabilized. Anticonvulsants are the long-term stabilizing drugs that are sometimes prescribed to treat mania episodes. Bipolar disorder medication alone is not enough. A person should also include therapy. Research shows that the people who take medication for bipolar disorder tend to recover much faster and control their moods much better if they also get therapy. Therapy gives you the tools to cope with life's difficulties, monitor progress, and deal with the problem bipolar disorder is causing in your personal and professional life. Some of the types of the therapy are the cognitive behavioral therapy. You can examine how your thoughts affect your emotions. You can also learn how to change negative thinking patterns and behaviors into more positive way of responding. Family-focused therapy. Living in a person who has a bipolar disorder can cause strain in the family or marital relationships. Family-focused therapy addresses these issues and works to restore a healthy and supportive home environment. It educates the family about the disease and how to cope with its symptoms. Other than therapy, a patient should also include exercising. Getting regular exercise can reproduce bipolar disorder symptoms and help to stabilize mood swings. Exercise is also a safe and effective way to release the pent-up energy associated with maniac episodes of bipolar disorder. Stable sleep schedule. Studies have found that insufficient sleep can precipitate maniac episodes in bipolar patients. It is to keep symptoms and mood episodes to a minimum by maintaining a stable sleep schedule. Healthy diet. A patient should avoid caffeine, alcohol, and drugs as they can adversely interact with the bipolar medications.